Good evening, everyone. This is Art Shead with the Shead Group, and tonight's presentation will be about Medicare and long-term care. Another look. We call it another look because it's definitely worth your time. You need to understand what to plan for, especially when it comes to long-term care. Remember, it's not the Medicare that bankrupts you late during retirement. It's the long-term care. Hey, we are different than other agencies in that we teach certain strategies that will reimburse you the out-of-pocket expense for Medicare services while you plan for the long-term care spending. And we'll show you that um, if you decide to have a meeting with us, either by web or in person or in one of the group sessions that we put on all over the state of Indiana. So without further ado, let's just kind of jump into this presentation. When dealing with Medicare and long-term care, there's a few things you need to understand first. All right. So on the left-hand side, with regard to Medicare, and if you have sat in one of our seminars regarding 7 things you need to understand about Medicare, some of these things will sound familiar. But first and foremost, you'll see that there's 60 million people in the Medicare space today. It's growing some 10,000 people per day, so 1.2 million people per year. Medicare is actually very simple and easy to understand. So anyone who says it's confusing or they tell you that, for political reasons, they believe X, Y, and Z, I'm telling you right now, throw all of that out the window. You don't need it. Just deal with the facts on the ground with regard to the system. If you read over the information, it's very simple and easy to understand. All right. Now, if you have that red, white, and blue card available, I tell everyone you're in business because that card gives you access to lower cost for medical and hospital services. All right. Now, when it comes to Medicare Part A, that is the most expensive part of the Medicare system. When you're dealing with Part A, you're talking about hospitalization and facility cost. All right. When you're dealing with Part B, this is the most utilized part of the system. And of course, it does require that you pay a premium. And of course, the government indicates that they will cover 80% if you will cover the 20%. So not a bad deal. The Johnny come lately to the Medicare system is the Part D system. Came into being some 2005, and of course it is required. If you don't do it, there is a penalty and some other things that happen to you, so you definitely want to make sure you have a Part D in place. And of course, last but not least, and most important, Medicare does not cover long-term care. So if you thought you could buy the super duper Medicare supplement and spend a little extra money there that would somehow cover the cost of long-term care, not going to happen. All right. If you pay close attention to your Social Security document, which a lot of you probably didn't look at, but on page 4, I say you didn't look at it probably because it was online. If you received the paper, it's on page 4. Anyway, they tell you Medicare doesn't cover any form of long-term care. So they remind you that you will need some form of private insurance in order to cover those expenses. Okay, so 60 million people in the Medicare space, and of that 60 million people, on the right-hand side, you see only 8 million long-term care policies active. In other words, that's a rough number, but 8 million is pretty solid. Remember, the government doesn't help you. Why are there so few policies? Well, long-term care is extremely expensive, all right? And it's difficult to underwrite. And even for those individuals, and I've spoken to plenty of people who looked at the asset purchase. So you have your income and you got an asset and the CPA or CFP, and I'm not picking on people. All right, I'm just saying what happens. They tell you, hey, let's just purchase the long-term care through the asset. That way it's covered. Okay, most of you decide not to do it. Okay. And the reason why you decide not to do it is because you're not even sure if you are going to need it. All right. But I can assure you the statistics when it comes to long-term care, they tell you today that 65% of individuals 65 years old and older will need some form of long-term care today. So with that, we start the presentation regarding what you really need to be paying attention to when it comes to long-term care and, of course, Medicare. We're using the Sun Life chart. I have always liked this chart because it's very, I like the way they lay it out, and it is laid out properly when it comes to spending for health services while in retirement. So this stage, this is called the 5 stages of care in retirement. And let's just deal with the bottom half first. When we deal with the bottom half, we're talking basically about basic living services and or what most people call long-term care. All right. So you see the 5 stages across the bottom. You see there's an independent stage, then there's an interdependent stage, the supportive living stage, and of course the crisis management and dependency stage. All right. And of course you see the basic living section is grayed out across the middle, across all 5 stages of this paradigm. Okay. So what is basic living or what is long-term care? Basic living, basically, it is services that you will need or require on a daily basis. A lot of bases in there. But anyway, you're going to need it every day. All right. And early during retirement, you're doing this for yourself. No problem whatsoever. Later during retirement, you're going to be needing some assistance, and the cost of that assistance will go up exponentially as you move through the system. So that's basic living. So what's basic living as an example? Let's say you get up and you go back and forth to the bathroom, right? You make breakfast, lunch, and dinner for yourself. You get yourself to the grocery store, or you're transferring from one room to the next room. All these different items are things you do for yourself today. Those items you'll need some help with later. That is long-term care, or what we refer to as basic living. Now, across the top, this is important because this is your Medicare utilization. So this isn't talking about the premium dollars that you're paying. This is talking about or referring to the services that you are seeking while you're in that Medicare system. Okay. So, and you see the mustard looking color, lifestyle. I may refer to that as quality of life throughout the presentation. And of course, when they speak of health, we're talking about Medicare. We're talking about Medicare utilization. How much are you spending in certain areas? So dealing with stage 1, this is the newly retired. These individuals require no assistance when it comes to basic living. They're doing it all themselves. And up top, you see that the quality of life is really high. All right. And the healthcare utilization is pretty low. At best, you're probably going back and forth to your primary care doctor, probably having them look over, do the physical exam and look over the chronic conditions that you do have, along with the prescription drugs you're taking because of them. All right. So that's phase 1, newly retired. This is the reason why you are traveling as much as you are, because you're feeling great. Okay. So moving to stage 2, you see these are the interdependent years. It says a senior will need some assistance from a family member. Okay. For any of you who have had this experience, the family member services are generally provided free. Okay. You're not spending any additional money in this particular section, but they may be coming over on the weekend or maybe sometime during the afternoon after work in order to help out around the house. Maybe they're doing the laundry or cutting the grass or just small things that you're probably going to need some assistance with. Now, when we look up top, look at the healthcare utilization has started to tick up a little bit. The lifestyle or quality of life has started to diminish just a little bit. All right. And again, when it comes to the healthcare utilization, we're basically saying you're going back and forth to your primary care doctor and maybe a specialist. You're still monitoring those chronic conditions and the prescription drugs that you're taking in response to the chronic conditions that you have. So that's stage 2. Then stage 3. We're going to spend a little bit of time in stage 3 because this is where the transition happens. And these are the supportive living years. An individual during this period, they're receiving help from a family member, but they're also starting to receive some limited formal care. Okay, so let's say the family member, free, remember, they're coming over and helping you out at no cost. But they can't do this every day. So maybe, again, they're here on the weekend. They're helping do the laundry, cut the grass, do some things around the house. But they really can't afford to miss any work, all right, during the work week. So maybe then they will hire some formalized caregiver to bring services to you, to your home. All right, so in stage 3, the transition that happens is that now you're getting some limited formalized services, and they're happening within the confines of your own home. So And there's a progression here too. So maybe they are there for 2 to maybe 3 hours to start with. Maybe they're just cooking you breakfast and lunch, and then maybe a family member is coming back later in the evening in order to help out. And then it will progress to maybe 3 to 5 hours a day, and then maybe 8 hours a day to some point. Maybe then they are there 24 hours a day. All right. So, and it's at this point, I try to tell people, this is where the unplanned spending starts. Okay. You planned for the Medicare costs. So when you look at the Medicare utilization, all of that cost up there, you planned for. You bought the Medicare Advantage or the Medicare supplement plan with the Part D built into it, and you planned for this particular cost. But when it comes to the basic living, long-term care services, when you're home and need care, this is what you didn't plan for. So now you're starting to reach into your income and probably into your asset in order to pay for some of these services. Okay, this is what's happening in stage 3. Okay, a lot of the care you're receiving, once again, is at home. All right, now you transition to stage 4, a crisis management type situation happens, which probably puts you into some form of assisted living. Okay, now you go from being home to being in some form of assisted living to receive some basic living services along with some medical services that you will need. Now, that is 3 areas. Okay, we're talking about the actual facility where you're paying them, okay, for services that you weren't paying for when you're at home, and you're paying for the basic living services that you will need assistance with. Okay, so maybe that's someone's there to make sure you're getting your medications on time, and maybe there to make sure you're getting 3 square meals a day and maybe some snacks. All right, so basic living services are being paid for. And of course, you've outlined or laid out the cost for the Medicare, right? But you're starting to utilize a lot of more in the way of emergency services and probably even some inpatient hospitalization services. So your healthcare cost has ticked up, your lifestyle has diminished, and of course, you're starting to utilize more in the way of basic living services at the facility, and of course, for the particular services that you need. So that's stage 4. In stage 5, we are pretty much full blown 24 hours a day Medicare services that are being rendered to you, and also the full complement of basic living services that are being delivered to you at a facility. Okay, so we told you that it was an assisted living facility in stage 4. Now in stage 5, it's probably more of a nursing facility, okay, where you can get 24-hour Medicare services across the board along with those basic living. So those are your 5 areas, all right? And of course, again, we tell you, you didn't plan for the basic living services, and primarily because you didn't know if you were going to need it. And of course, you told yourself that it was too expensive to purchase at 65 or whenever it was that you decided to look at it. We understand that. Okay, we definitely understand that, but we're just telling you, it's at this point where most people will make the decision, and this family member, okay, they're making the decision to sell off a family heirloom. All right. Or maybe they have made the decision to sell off certain property or maybe land. I've seen this happen. I'm just telling you about things that I've discussed with clients. And maybe you've done the reverse mortgage in order to take care of the basic living costs. All right. And all those things you're doing, again, because you decided not to purchase it. And again, we understand why you didn't purchase it. Of course, again, we at the Shead Group have another solution that you should look at because it will definitely offset the amount of money that you would have to spend. So the healthcare cost, of course, went up because you're utilizing more in the way of Part B services in stage 4 and 5. Okay, not sorry, stage 4 and 5, you're utilizing more of the Part A service. So a lot more in the way of hospitalization, skilled nursing services, rehabilitation services. Part A, remember, that's the most expensive part of the Medicare system. Early during retirement, when it came to stage 1 and stage 2 and portions of stage 3, you were primarily using a lot of Part B in the way of services. Okay, so, and of course, if you're looking at the cost of long-term care today, They say annually in the United States it's about $90,000. Now, there's a big difference between the care that you'll get in stage 4 versus the care you get in stage 5. On average, you're probably looking at about $55,000 a year in stage 4, and then of course in about $90,000 in stage 5, if that makes sense. So all that being said, this is what you have to look forward to. So we admonish people to think more about retirement from the lens of long-term care, because that is the portion, again, that will bankrupt you. All right. It's not the Medicare cost, because the premium that you're paying generally covers whatever it is that you're looking at or need. All right. It's the long-term care cost. It will impact your income as well as your assets. Now, this conversation isn't geared for individuals that make less than, let's say, $1,600 a month. All right. For those individuals, and I'm not picking on people, I'm just dealing with the facts. For those individuals making $1,600 or less, they have access to both Medicare and Medicaid service. Then the Medicaid service will help cover some of the long-term care costs. All right. And of course, we're not speaking about those individuals who have $250,000 in income plus assets. We're not talking about that particular group. However, I will say, with regard to even that particular group, if you have cognitive impairment that runs in your family, or you think that may be an issue, look, $90,000 a year, all right? People with cognitive impairments basically distort the norms, all right? They're generally in facilities a lot longer than the 2.5 years that you'll see in the long-term care document. Most of the people who have some form of cognitive impairment will spend roughly, it could be 7 to 10 years in a facility. So take 90 times 10, you get my point. That's a lot of money. Okay. So having some arrangement set aside to cover this cost is important, especially for those individuals in the middle class, because it's their income and their assets that are the most in the way of exposed. All right. So, and think about it this way. You didn't work 40 plus years of your life in order to turn around late in retirement to just throw it all away. All right. So you need to have some game plan for your long-term care spending. Of course, with the Shead Group, we can help you facilitate the things that you need to do. You can reach us 1-888-969-7822, or me directly at 317-965-0261. This is the end of the program, folks. What makes us different? We're different because we help get our Medicare recipients reimbursed for Medicare out-of-pocket expenses, and we show you how to indemnify all of your Medicare spending. All right. If you can benefit from having $500,000 available for healthcare spending during retirement without having long-term care, I mean, we're willing to show you how to get that done. All right. So give us a call, 317-965-0261 or 1-888-969-7822. That's the end of the program for today. If you have any further questions, reach out to us on the website, or after this program, hit the comment section and we'll be glad to reach out to you and set up some time to meet. So all that being said, we are done for the evening. Hope you enjoyed the program. Look forward to the next one. Bye-bye.